Hello, I'm BJ Daniels, Assistant Dean of Assessment in the MD program, here to talk about entrustable professional activities. So you may be wondering, what does it mean when the student asks for an EPA? Well, there's two kinds of EPAs that a student may ask for. The first involves direct observation, where you are in the room with the student and the patient, watching them talk to the patient, do a physical exam, or maybe do a procedure. The second type involves what we call indirect observation, which are discussions often without the patient present, such as a typical case review, or maybe interpreting an investigation. Some of the EPAs the students need require direct observation and some indirect observation. But don't sweat it. The student will tell you if the EPA they need is a direct observation or an indirect observation. There are three key components to an EPA encounter. First, the learner identifies an EPA before the encounter and explains if it's direct or indirect. Then the teacher watches or discusses with the learner depending on the EPA, with the frame of reference being a fairly independent student at the end of their clerkship. And then you give feedback, positive and something they need to work on. A pro tip is to have the student fill in everything you said on their device, be it a mobile device or computer, take a quick peek, and tell them to submit. No save for later. We have tons of EPAs sitting in the save for later email inbox void. Say no to the save for later button. If you have any questions about this, please feel free to email me at vdaniels@ualberta.ca. Thank you for your help with the EPA rollout in the MD program.